On today's episode of Investing in Cannabis, we sit down with David Hua, the CEO and co-founder of Meadow. Meadow connects medical marijuana patients with reliable dispensaries to get quality medicine delivered to your door. You can find our show, Investing in Cannabis, everywhere media is currently being consumed. Enjoy the show.
What's good, everybody? Welcome to Investing in Cannabis. I'm your host, Brandon David. Super excited for today's guest. I reached out about a month ago for no better purpose other than just, hey man, I think what you're doing is really cool. Can we get together and connect? He was nice enough to invite me to his beautiful new office, and we thought we'd shoot a little podcast thing. So please welcome David Hua, CEO, co-founder of Meadow.
Woo!
Yeah,
all right. Woo!
Yeah.
Thanks, guys. Thanks. I'm kidding. Thank you.
Cool. Well, thanks again for being on the show, man.
My pleasure, man.
Why
Thank
don't you
for
just
having
start
us.
by telling us what Meadow is?
Sure. Meadow is one of the easiest ways you can use to conveniently get medical marijuana delivered to your door.
Amazing. Yeah. And how did this concept come up? I mean, what were you doing that you decided, hey, I'm going to start delivering marijuana?
Yeah. Actually, the story happened about a little over a year ago. I ended up going to Oaksterdam University. It's this cannabis college out in the East Bay. What's really cool about it is the faculty is completely comprised of advocates and people within the business and people are operators that take time out of their day just to come and teach, which I thought was really awesome. And one of the people that I met was Debbie Goldsberry. She runs currently a dispensary called Magnolia out in the East Bay, but she was one of the original co-founders of BPG, Berkeley Patients Group.
Yep.
And she basically walked through her day-to-day of operating that business, and it was pretty tedious. There's not a lot of software out there to help them run their business. The ways of processes and things are a bit antiquated, and there wasn't one system. It was a bunch of different systems patchworked together. And so we took that idea or that pain and that challenge and sort of incorporate into our personal challenge, which was essentially buying medical marijuana and getting delivered. The experiences at that time was still pretty
shitty.
Yeah. There it is. And so we married the pain of what dispensaries need to manage their business with the pain of a patient trying to order and get medicine delivered to their home, and created Meadow.
Yeah, so I think one of the interesting things you just said is that you're solving a pain point for the dispensary as well, which is in pretty stark contrast to others that are out there. Was it always conscious from the beginning that you wanted to keep the dispensary branding in the product?
Yeah, absolutely. I think dispensaries and collectives, and they all have their own unique identity, and it's not like you're just buying an eighth of marijuana. You're buying an eighth of marijuana or a high CBD strain grown up in Marin by a local farmer that's been doing it for a few years. I think there's different dispensaries that cater to different demographics, and I think it was important to focus, or at least showcase that you're buying from a specific one or another.
Mm-hmm. So you have this idea, you begin to build it. How do you get the first couple traction? I mean, it's kind of hard to figure out growth in the cannabis industry.
Yeah, we used it. I think building a product, oftentimes you are your best customer. So
you solved your own problem.
We solved our own problem.
Very nice.
And then, as we were using it and telling our friends about it, and they told their friends, as we kept checking in with the dispensaries and making sure we're building the right features for them, and building out our roadmap, that's kind of how it started.
Got it. And was it always your idea that you were going to apply to YC? Was that always something you wanted to do?
So it's me and three co-founders. Okay. All of us have worked together previously, and we all decided, let's apply to YCombinator and see if we can get in there.
So you get a phone call and you go for your 10-minute interview, right? They're 10 minutes?
Well, it was a series of emails, but
Okay.
we get the interview, and 10 minutes.
And how does that 10 minutes go down? I mean, what do they ask you?
It's probably one of the more intense Q&A Q&A sessions I've been in. Essentially, it's trying to, from their end, they're trying to get as much data as possible about what you're trying to do, what the purpose is, whether or not it's an addressable market that's big, and whether the team can execute. And yeah, it was 10 minutes of them asking questions.
Just grilling
just grilling, but it was fun. It was great. The partners are very involved, and it was cool. 2 of the partners that we interviewed with became our partners throughout the program.
Cool. And did they have any hesitation that it was in cannabis? What was their
their
feeling on? Yeah.
Yes.
That was a leading question.
Yeah. Absolutely. I think the way we approached it was really around just building software, and they understand technology, and abstract all of the the nuances of cannabis away. It's an industry that needs software, and they were totally behind that. How we operate our business and how we work by building the tools for the dispensaries is one of the things that were really attractive to them, because there's a lot of dispensaries that are coming online, and a lot of dispensaries currently that need a better platform.
Yep. And so you get into YC, you must be fucking stoked,
Yeah.
right? Like, hell yeah.
Yeah.
What's that first dinner like? You show up at the first dinner, and what happens?
Oh yeah, we were really stoked. I think at the first meeting is you see all these other entrepreneurs, and it's really cool because it's like finding your tribe, right? Everybody is super passionate about what they're working on. Everyone's really open to sharing what they're doing, and not only just what they're doing in terms of progress, but also sharing of like how they're feeling, what challenges they're overcoming, and all the founders could empathize with one another. If anything, also help. All of us are kind of walking down a similar path, and it was just amazing to see such great energy building something for the world. So it was great.
And these dinners have gotten pretty big now. How big are the class sizes in YC now?
We had about 114 companies within our batch.
Yeah, that's quite a bit. And as it's grown, do you think, well, you weren't in the previous classes, obviously, but obviously the value's still there. You're really excited. But I just wonder, as the class size grows, how many touch points do you get a week, or is it just that one dinner?
I think that I think YC is what you make of it, right? There's a lot of resources now in front of you. You as an entrepreneur need to focus on your business, but also leverage the resources that are available to help you push your business forward. I think that the class size for us was great. We had a chance to roll out features for our class and get feedback really quick, and understand that cannabis is for everyone. It's everyone, especially in the tech world. There's a lot of stress, there's a lot of anxiety, a lot of people have insomnia, migraines are prevalent, all these things that cannabis helped for a lot of our founder batchmates.
Yeah, that reminds me of an interesting story. So another part of your business is the doctor coming to your house, which I think is ingenious.
Yeah.
Basically, Dr. Dan,
Yeah.
right, who's a really cool guy, shows up at your house and says, what hurts, basically, right?
Yeah.
Like, how can I help you today? And he said, do you work in a startup?
Yeah.
And I said, yeah. And he said, well, it must be really, really stressful. And it really is,
Yeah.
right? And it just speaks to what you just said about. So,
super stressful.
I mean, the doctor is a tremendous amount of convenience. I learned a ton from him. He's super knowledgeable. There's all these little other options popping up now where you can get a phone call and a recommendation. You can do a video chat. Do you plan to continue to compete in that space, or where's Meadow headed in that way?
Yeah, I think the doctor service came up from feedback. A lot of patients kept coming to us and saying, "Hey, I can't leave my home. I just got shoulder surgery and I need to be home. Like, can you send a doctor?" And eventually, yes, we can.
Yep.
We can send a doctor to your home. And where we'll take the products, as long as people and patients tell us what they want, we'll keep building. And whether it's more convenience for telemedicine, whether the in-home visit, regardless of that, the biggest thing that we try to get across is an onboarding experience that educates the consumer, educates the patient about what cannabis is, depending on their level of sophistication, and really targeting their specific condition. So regardless of the mechanism, the channel, that's what we want patients to walk away with, so that they are aware, they know what's happening, and they can properly dose themselves with the medication that they're getting.
And the right strain.
Absolutely.
Right? Yeah. So
Yeah.
he specifically told me get something with purple in it.
Yeah,
Because
the
if
purple.
if you have anxiety or you
Yeah.
want to fall asleep, that's really the strain that you want to indica, and darker on the purple is the better, right?
Yeah, I mean, you can go a number of ways, but strains. If anything, you help the patient understand that there's something called a difference between strains. So when they do order, they at least have some sort of semblance of, okay, different strains have different effects. We should be looking for what those effects will help me the most with. And what's really interesting about cannabis is that so many different strains affect different people different ways. So you're kind of on your own journey to find the strains that you like. And that's kind of one of the most enjoyable parts for me. But for people that don't know, helping them.
Yep, totally. So you go through YC, you're really happy with the outcome, right? They ask for what percentage growth? They try to target what percentage growth? In
7%.
7%
is usually the goal.
And you guys crushed that goal,
We're
right?
we're good.
Good.
Yeah, we're good.
Sounds good, man.
Yeah, we're
Okay.
growing. I think it's a long race. So
Yeah. So it sounds like you have kind of the cannabis side down pat, right? And you have the tech side. Let's talk a little bit about the logistics. You decided to do this partnership with Sidecar.
Sure.
Can you tell me a little bit about how that came about?
yeah, essentially what we found within the current space that we operate in, there's existing networks or existing tools that we can leverage. And Sidecar, which is interesting, has a capacity of drivers. They also have a capacity of drivers that are able to do deliveries and package deliveries, or they can bring the person around. And instead of just thinking about people and packages, we were thinking about, all right, what about like patients and medicine? And Sidecar is really open to that. And why put more drivers on the road versus help you leverage existing networks and increase their efficiency and capacity. So that's the original genesis of why that partnership sort of came about. And yeah, so far so good.
And then all those drivers need to have recommendations as well.
Oh yeah,
correct?
absolutely, yeah.
Cool. So Dr. Dan was busy for a little while.
Yeah, well, no, I think a lot of them had their own
Already had it. Cool.
And what's really cool is the patients themselves were really stoked about it because they're believers. They want to help. And yeah, it was mainly on training, just making sure everyone knows the right laws and how to handle the delivery and what what they need to do. So yeah.
Yeah. You also work with another company that's very near and dear to my heart called OnFleet, and that handles like your delivery management software.
Sure.
Full disclosure, I started at OnFleet this week, so what up, guys?
Yeah. OnFleet.
Tell me a little
Love
bit about
OnFleet.
how they've helped you. Just a couple sentences, so Khalid can get off my back.
OnFleet is one of the no.
This episode brought to you by OnFleet.
No, I love the team over there. I love the problem that they're solving, helping scale. They're building tools as well, right? We have a very similar philosophy in helping businesses and helping their partners build tools and let them run their business. And it made total sense to find a logistics a software partner like OnFleet that cares about feedback, is willing to iterate pretty quickly, and looked at cannabis as just like any other industry. It needs to get one package from point A to point B, and how do we do that the most efficiently way possible, and not having to build it out on our own was definitely a really good decision. Yeah.
Commercial over. No.
Yeah.
Cool. So post Sidecar, what's next for you guys? I mean, what's the next product line you're gonna, what's the future look like for Meadow?
Sure. I think what's really interesting is there's still a lot of software to be built for all players within the ecosystem. Meadow is all about a gathering place, a platform, if we were speaking tech, but a gathering place for all people within the cannabis universe. That could be growers, vendors, dispensaries, patients, all these people and all the industries that they work in, or certain specifics of the industry that they work in can be part of Meadow. And so that's kind of where we want to take it. Delivery is still a big part, and that's what we're focusing on, but we'll see where it goes.
Talk about a little bit more about the cannabis community. I mean, I think that's one thing that you guys really have hit on the head with the events, and as opposed to some others that maybe are just still slanging weed. It's a different kind of mentality.
Yeah, I think what's really amazing about the community is how open and warm and generous they are, right? I think everyone in this is in it together. It's not so much me against you, it's us together helping to enlighten others that may or not be, that may be ignorant of all the things that cannabis can help with. So we're stronger together. And what's really great is focusing on building those relationships, enabling people to meet and build those bonds is going to help everybody. And it's really great to hang out with like-minded people. Just like finding our tribe within YC, we have a tribe within the cannabis community of very like-minded people that want to see it in a very elevated and enlightened state of where it currently is.
As this community galvanizes more over the next year or so, and we get recreational in California, I personally believe that'll happen in 2016. It's on the ballot, but fingers crossed, right? How does that change Meadow? What's that look like for the business when it becomes recreational?
Sure. I mean, we haven't really put too much thought into it.
Okay.
We know it's on the ballot. We know it's coming. I think a lot of the focus currently for us is medical and figuring out how to help people with these conditions find the right medicine for them. I think at the recreational level, you'll find that people are using it outside, using it at the bar, going different places at the park, what have you. I think that's great, but there's still a lot to be done with the medical side. For instance, we had a patient last month that hasn't smoked at all, ever, in her whole life, had migraines constantly, twice every, three times a day, right? And we were telling her about, hey, why don't you try tinctures, these 1-to-1 THC to CBD tinctures that should help bring those migraines down. And she ended up getting a recommendation, still hasn't smoked, bought a few tinctures and tried it out and hasn't had a migraine in 3 months now. And so we checked in with her last month, and I'm assuming it's been 4 months.
Yeah.
But it's someone like that you would never think is a cannabis smoker, but has so many more applications that can apply to other people. And you're seeing that movement happen with kids with epilepsy. You're seeing that happen more with veterans with PTSD. There's so many different conditions, and this plant can really help. And so we're focused on medical.
What a great success story for her as well.
Oh, it's amazing.
Yeah.
I'm like,
changed her
yeah?
life, right? Yeah.
Yeah.
I read recently that 50% of legal revenue is now edibles or not smokable products, which is fascinating, right? I don't think most people think they think, oh, people smoking pot, right? But it's really, it can be totally innovative.
Absolutely.
Yep. Very cool. Cool. So as you kind of build the team, you're a very culture-driven dude, and that's a word that gets thrown around a lot in San Francisco. But what are some of the values that you want to have in your team, in your company as it grows?
Yeah, we're still working on. We have a working list. It's not necessarily like these are our core values. We actually we position them a little different. They're our principles. We think a lot about humility, and that humility is sort of drawn by by respecting the people that sort of come before us, and there's tons to learn from there, but also from new people coming into the space or whoever we're working with. I think humility is a big piece.
Who are the legends that you're talking about? Who are the people before you that inspired you?
I mean, Steve D'Angelo is probably one of the guys at the tip top. Debbie Goldsberry is amazing. I met for the first time a guy that was an AIDS patient back in the early mid-90s when they first got Prop 215.
Wow, yeah.
I mean, he was a guy that had a card, and he's like, I'm the guy. I'm like, you're the guy. Oh my God.
You're the guy.
You're the guy that fought and pushed this to where it is today for us to help bring it through. And
do you know back then, I'm not aware, how difficult was it to get a card? I mean, obviously he was the first one.
It was super different, man. I mean, the movement was really about compassion for these communities of people that were, specifically HIV, right? It was ravaging a lot of these gay communities, and people needed help. And this woman, her name's Mary, she made these brownies infused with cannabis and gave them out to all of these different patients to help with their pain. And she got arrested, and then that got in the news, and more people pushed, and then it came to a groundswell of support to get this through. And you know, that the board of supervisors and the people and that got that through was huge. And that's the only reason why we're here today. Yeah. So humility is one of our big principles that we think about.
Yeah, that's definitely a different one for tech startups, right?
No, I think humility is good for a lot of people. I don't know.
No, I think it's amazing. I wish more tech startups had that as one of their main values. Yeah. Okay, so one of my favorite questions as we start to wrap up here is, what's your favorite strain? How do you like to smoke? Why? What's your mode?
Sure. I'm in kind of like R&D mode right now. I'm literally trying a lot of different things. I'm more biased to a sativa. One thing I'm really liking are Hepburns.
What's a Hepburn?
Oh man, do I have a case? Hold on. So Hepburns are come in these little boxes, and they're like cases of 5, joints.
Like Audrey Hepburn?
Yeah, Audrey Hepburn.
Got it.
And what's cool is it's flour mixed with ice water hash.
Ah.
Yeah, super cool. So I like these.
That'll really get you.
Well, I take a few puffs of that, and that'll get me going for most of the day. But I'm a big believer in like microdosing.
Yeah.
So, not getting stoned, but just a nice lift and keeping it consistent through the day.
Got it.
So, Durban Poison, Lamb's Breath, sativas. Like that's kind of what I go for.
Yeah, my favorite all-time strain is Green Crack.
Yeah.
Which is absolutely horrible name.
No, it's great.
For cannabis.
No, it's the best name ever.
But I can never find it. All the growers are out these days, and it's kind of sad.
I totally recommend more CBD strains though
Yep.
at night. I've been really into AC/DC, Canatonic. Those two are pretty solid. Harley Sue is good. It's a mix between Harlequin and Suzy Q. Suzy Q is another one that's more CBD, but it's really good just to relax and calm the nerves or anything like that.
Very cool. Very cool. Well, thanks so much for being on,
Dude,
man.
this
was
great.
really fun. This was really fun. You have a beautiful office, a beautiful day.
You're a beautiful person.
Life's good.
Yeah, life's great.
Good. Thanks a lot, man.
Yeah, appreciate it.
Yeah. Thanks a lot for watching, guys. I'll see you next time.